This program and its contents are designed for information and educational purposes only. This program does not render medical advice or professional services and is not intended to be a substitute for professional care. The information provided here should not be used for the purposes of diagnosing or treating a medical or psychiatric condition. If you have or suspect you may have a health problem, consult your healthcare provider.
Hi, welcome to Positive Momentum TV. I'm Diane Silva, and we're going to continue our series on Alzheimer's education and information. And today my guest is Marty Hug with Agemark, and Marty is the COO, and I'm going to let him kind of take it and talk about the processes and Alzheimer's and just let you take it.
Sure, thank you, Diane. We deal with people. We work with people that and families that have been diagnosed with Alzheimer's and other dementia-related illnesses. And when they first come in, clearly it's a very fearful event. They have found out that the loved one they have has been diagnosed with this, and what do we do? And there's lots that you can do to treat this disease and work with this person even before you get to our stage, which is looking for placement in a community. Oftentimes, when somebody's been diagnosed with this, the first step is to get information. And there's lots of ways to do that. The Alzheimer Association is a great source, so are local hospitals, social service entities, and what have you. And usually, when a diagnosis has occurred, it's primarily going to be early stage. So there are resources available, home health companies, home care companies, people that can come into the home and provide some assistance, support groups. Support groups are so important because oftentimes families will say, or they'll feel like they're on an island and they're walking through this disease by themselves. The truth is, there's lots of people that are afflicted with this disease and lots of families that have to deal with it. And so support groups, you figure out you're not on an island, you're not by yourself. And you find out from other people walking the same walk what they're doing to make life better for themselves and the person they love. That's all important because what we see in our environment is that oftentimes the person that struggles the most and is affected the most is the caregiver.
Yes.
There's a denial that takes place when that disease has been diagnosed. And the caregiver will say, well, I can do this. I can take care of this person because they have their whole life. And we saw that in my family with my grandmother and then my uncles caring for her. Well, we're going to take care of this at home for a time period. And it began to take a real toll on my uncles, and it does on any caregiver. And if you don't get some help, it usually puts two people in a bad place. Not just the person that has the dementia or the Alzheimer's, but also the person caring for them, because physically and mentally they just can't keep the pace. And so getting some help is not it's not a weakness, it's a strength.
Well, and I will speak to it just briefly, my husband's sister comes in twice a year.
Right.
And although my mother-in-law is in a community, the stress on us is shown by every time she walks in the door, we get sick. Mm-hmm. So, you want to speak to that a little bit because,
Sure. Well, when you're caring for somebody with the disease, there's really two things that you're doing. One is you're caring for their activities of daily living and their health care issues, their health care needs. And then you're also you're taking care of their social and their spiritual and their emotional needs. And that's a big burden both ways. So the first one is easiest. That's making sure that they get fed correctly, they have the right diet, that they are taking their medications properly and all of that. And that's typically what home health and home care will do, but they can't be there 24/7. They can, it's very expensive, to then meet the social, spiritual, psychological needs. So the family oftentimes will try to do both, or they'll try to do this one over here or this one over here, but they can't do the other one. It's too much. It's too much for anybody. It's that old saying, it takes a village to raise a child.
Yes.
It takes a village to take care of somebody with Alzheimer's or with memory loss. It takes more than a small group of people. And as anything, if we're overburdened mentally or physically, it manifests itself in illness
Right.
or in just wearing down. And that's not good for anybody. So now you have two people going down versus one that has a disease and it's progressing.
And that's where the communities come in.
Exactly. The beauty of a community, when it comes time for that community, is that there is a multitude of people doing different things, all for the benefit of this person that has been diagnosed with this disease, but also for the benefit of the family that cares for that person. So it doesn't mean the family can't still be involved. In our communities, we encourage participation in everything, whether
Right.
it's meals, activities, what have you. The beauty is the family gets to decide. And if they decide, well, listen, I don't have the time to spend eating with mom or dad today, somebody else is going to do that, and they're going to meet that social need and make sure that mom or dad are eating properly. So you can participate as much as you want, but you can back off and get that respite when you need. And that's the nice thing with the community, or really any support that you can find to assist you.
Yeah, even if before they go to a community,
Exactly.
It's great because, and one of the things I want to stress is, please work to not feel guilty about, okay, I need help. That's not a sign of weakness. You need that. We're here to be responsible for ourselves.
That's right.
And take care of others while we can. And as I say, and I'm, love thy neighbor as thyself, not more than, not less than, but as.
That's right. You have to take care of yourself to be able to take care of somebody else.
The airlines.
That's exactly. Yes, it's the oxygen mask thing. And you said it, and I totally agree. It is not a sign of weakness to ask for help. That is a sign of strength. It's realizing I need somebody to help me carry this burden, and there's nothing wrong with that. We all need help.
Right.
We all have an issue that we deal with, and we have something or someone that helps us with that issue. And this is the same thing. And the more people we get that rally around it and help us, the better we are. And truthfully, if we were to ask that person that has the disease what's most important to them, they're going to say us. They want to know that we are well taken care of. And for us to be well taken care of, we've got to have somebody help us care for that person that we love.
Because they're not going to want to sit there, especially if it's your parent or even your spouse, anybody is not going to go, oh, well, this is all about me, this is all about me, this is all about me.
That's right.
That's not how they raised us, that's not who we married, so.
That's right. Well, and let's internalize it for a minute. So if I were to be diagnosed with Alzheimer's today, I would not want to think that my children were going to have to care for me and have to, that it would interrupt their life.
Right.
Certainly it would some, and I get that.
Yeah.
But if I knew that every waking minute they were anxious and concerned about me and they couldn't go off and do the things that really matter to them on a personal level, I would be very sad. And so we need to realize that. Our parents, our grandparents are the same way. They don't view it as a weakness either, that
Right.
we would ask for some help.
And I don't think any one of them will say, oh, you're throwing me away.
No.
They may have their moments where, they're really confused or frightened, and they may say that. But at the same time, if they do, don't take it personal, because it's not personal. It's the fear and the disease talking.
That's right.
And if you were to catch them at a more lucid and calmer moment, and they would say, no, you need to take care of you. Yeah, I understand. We'll tell Pat time and time again, you have the luxury of living here. Oh, do I have to live here my whole life? Can you think of a worse place to go? Yeah, I can. Okay.
Yeah.
So just trying to change it just a little bit and then move on.
That's right. That's right. It's you're really you're addressing the issues, you're addressing the behaviors. Doing a little bit of re-educating at the time, knowing full well you're going to have to come back and do it again.
Right.
Getting them to a better place, and then you move on.
Right. You don't stay there. You don't unpack and live there. It's okay to feel crappy, and then you move on.
That's right. and you're exactly right. It's okay to not feel good about it.
Right.
It's okay to understand that it's a tough situation, but it's also okay to realize it's not a death sentence, at least not today.
Right.
Certainly it's not a disease that we have a a cure for yet. And so obviously people die from Alzheimer's and memory loss, other diseases of memory loss. But we can have still a wonderful life for the time period that we have. And through medications and support and other things that we've really figured out in the last 5 to 10 years, there's hope. And we can extend life, and we can make it a wonderful life for that extension. And it's not something that we say, oh gosh, it's over and there's nothing we can do about it. I often talk about, if you look at where HIV and AIDS is today,
I was just thinking that.
versus where it was 15 years ago, that's how I see Alzheimer's. We're moving in that direction. And truthfully, it's where polio was so many years ago. It's the polio of our time. I'm convinced that through support, through education, communication, funding, we're going to find ways to treat it, and we're going to prolong it so that we have more time to figure out a cure, and it's going to happen.
And one of the things I would like to touch on just briefly is we mentioned making that person's life normal, making them comfortable, making them happy. Their life's going to be, we have to do that for ourselves too.
That's right.
As a caretaker, because as you pointed out, if we're making that, we're focusing 100% or 150% on them, we're losing us. And they wouldn't want that any more than we would want that, because our life is then, we don't want to make our lives miserable.
That's right.
There's no trade-off or saying, okay, no, your life's more important. No, we're going to do the best we can to balance. And that's where a community comes in, or a home health care, or whatever. We need to take care of us. Again, back to the oxygen mask, the airlines, and such. So, go ahead.
Well, what I was going to say, it's so interesting you say that. The sign of a good community, no matter whose community it is that the staff recognize that. So we're all mirrors of each other.
Right.
How we act is how the person across is going to act. And what we tell our staff is, when you come to the door of this building, whatever you have going on in your personal life, let it go. Because once you go through here, your job is to be happy and smiling and everything else, because that's how the people who live in this building will be. It's the same way with family members. If you can take care of yourself and then you're in a good place, when you're interacting with a person that you love that's afflicted with a disease, they're going to mimic how you are.
Right.
If you're relaxed, if you're happy, if you're balanced, they will be that.
Same way with a child. So
Exactly.
Anybody, especially those who are not quite able to communicate for themselves yet.
That's right.
Or even a friend. Think about it. Talk about peer pressure.
Yeah.
Same thing.
Exactly. So it's so important that we take care of ourselves, because we're so focused on this other person. And if we don't look inside and take care of ourselves, it's not going to give us the time to take care of this person. We're going to need somebody then to take care of us. And
them.
And them. And then we've achieved very little.
So it's okay to pick up the phone going, hey, Marty, I need some help.
Absolutely.
Or, in our case, we'll get a few phone calls, and we'll either call his sister, or she just woke up, she's kind of, we'll call Country House and say, she just woke up, she's hungry, we'll be right in there to check on her. And that's great. It's relieving the pressure off us, it's making sure she's taken care of, and we can go back to taking care of what we were taking care of at the moment before.
That's right. It's sometimes it does feel like an island. Sometimes it feels like we're the only ones going through this. The truth is, there's lots and lots of people going through this at exactly the same time or before us, and some hopefully less after us. But it's not looking that way because of the way the population is expanding on the senior horizon.
Well, something's going to get us.
That's right. So there's statistics, and the one I always share is that if you're 85 and older, about 40% of those people are going to be diagnosed with memory loss and Alzheimer's. And so that's a lot of family members that are going to be caring for people that have this disease. That's a lot of support as well. That's a lot of support groups. That's a lot of power behind a disease, as far as people who can say, I've walked this walk, and I'm walking this walk, and let's figure this out together. What are you doing that's working for your loved one? Here's what I'm doing, and you can share information, and it's not an island.
Right, and here's a resource, and here's a resource, and by the way, Alzheimer's Association, and like you said, hospitals, doctors' offices, social work, any you can almost blink and turn and you find somebody who can at least assist you or has been familiar with this disease and knows, oh, here's this book I read, check
That's
this
right.
out. Or, I know somebody who's, or, talk to Marty, or go talk to Stacy, or go talk to Tracy, Tracy's, and they'll be able to give you insight.
Exactly.
You know.
And even subsidy, they're beginning to put subsidy packages together for to assist people who maybe don't have the funds for certain things. There's a thing called the Medicaid Waiver program, which can assist people with getting services at home.
Right.
And it's based upon income, but it's an effective way to maybe pay for some home health services, day away services, things like
Right.
that. So there's lots of resources out there, lots of people you can talk to. Certainly, we oftentimes are a clearinghouse of that information, but other communities are as well. So are other entities like hospitals and so forth.
And I notice driving around town, every time you turn, there's a new facility or community coming up somewhere,
Right.
and you're kind of going, holy crud,
Right.
So
Yeah, Les, we can talk about that. So, unfortunately, the disease is not going away, and in fact, it's been an epidemic for a long time. But we are shining a light on it. It has been over the last 5 to 10 years, and so there's more awareness. So there's a lot of providers getting in the business of providing housing and services for those that suffer from memory loss, and that's good. It can also be bad, and the bad side is it's not about real estate. So
Right.
the community itself, the real estate can be beautiful and so forth, but what really needs to occur is what goes on inside that building,
Right.
an understanding of the disease and providing the necessary services so that that person can live safely, effectively, and with dignity. And my hope is, as these new communities spring up, that they realize that. My guess is most will. Some may not, and those will not survive because people want more than the real estate, and they should.
well, and you're paying for more than real estate because this
Yes.
is not a cheap alternative, but at the same time, look at what you're getting.
That's right.
You're getting relief. They're getting 100% 24/7 care. You got nursing. You got a nursing staff. We have luckily a doctor that actually makes house calls over there.
Yep.
Which is great, and dentists come to so I mean, they're in a stress-free environment except for the stress of the disease, which is enough.
Right.
And we're getting to the point where how much do you pay for a babysitter? And if you had to pay for a babysitter full-time, a nanny,
Yeah.
24/7 nanny, not just
Exactly.
several nannies.
Exactly.
So it's a luxury in some aspects, and like you said, you got the Medicare and other facilities or resources that are now helping people who don't have the resources or the luxury of having I know some people have great, what are they called, long-term care insurance.
Oh, yes.
So
Yes.
some of them are great.
They're fantastic. Some are a little bit more structured and more difficult to tap into for things other than nursing home care.
Right.
But more and more we're seeing that those plans, those insurance plans, really branch out and they cover lots of different options, assisted living, support services at home, and things like that. It's a really neat thing to see because people are going to need that.
Right, and there's other I'm sure there's other resources because there are people who don't have the long-term care insurance.
That's right.
Or whatever, and they're having to do this on their own, and it is daunting.
That's where Medicaid Waiver and some other support, fiscal support services come into play. I lost my train of thought. I apologize.
That's
you
all right.
said something really, really important, and I lost it. It'll come back to me.
Oh, I'm sure. Well, my train leaves the station without me a lot. I have to buy new tickets all the time. I'm going bankrupt buying tickets, or getting help out there to clean up the wreck. But one of the things, I don't know how well the Alzheimer's Association is able to pull their volunteers in to maybe help people who are still at home. Or, I don't know. And we'll put out information on the Alzheimer's Association as well as Marty's information and Mike Hughbanks, who is a person with diagnosis. Wonderful information. So back to our discussion on, we're both having a brain cramp at the moment. Sorry. Anyway, with this Alzheimer's, dementia, like you said, other diseases as well, everybody needs support. You're not an island.
That's right.
So, even if I have high cholesterol or diabetes or something, there are people around that can help me get educated, work through the anxiety of the disease. Because that's one thing I've dealt with my mother-in-law and even my own is, can you imagine the anxiety and the emotions you're going through? Think about it when you go to the doctor's office and you hear a word you don't like, and all of a sudden you hear Charlie Brown's wah 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 wah.
That's right.
You don't hear anything else.
No, it's the fear. It's the fear of hearing something that you don't want to hear, and sometimes the stigma of that. People understand what the word Alzheimer's means.
Yes.
They understand that there's not a cure. They understand that eventually you're going to die from that disease or something that related to that disease. And the other thing that I've heard a lot is from seniors is they understand as we get older, and we all do, that we're going to lose certain things. We're going to lose certain things of independence that we have. Eventually we're not going to have a job because maybe we can't do what we do, or we get to a point that it just doesn't make sense for us to continue that. We're going to have personal losses. We might lose a spouse, we might lose a child, we might lose somebody in our family that we care for. Physically, we become more frail, and so it's more difficult to move. And it goes on and on and on. But the thing that we always think of is, well, I'm always going to have my memories.
Oh, yes.
And so we get to the end, and then you get diagnosed with Alzheimer's, and you realize you're going to lose some of that as well. And so is it any wonder why we have people that become depressed and fearful? Because the one thing they thought they were going to hold on to, they realize they're going to lose. And so we got to recognize that. And it's not an easy thing for somebody to hear, but it doesn't mean that we can't have a fantastic life, that we can't look past that and say, you know what, I have lots and lots and lots of memories, and I might lose a few, but I'm going to maintain others, and I'm going to live my life, whatever's left of it, the best I can possibly live, and I'm going to matter, and I'm going to grow, and I'm going to care, and I'm going to do the things that make me a human being. So it's a scary disease. It's a scary thing to hear for the person diagnosed, but also the family. But again, it's also something that we can say we're going to build a plan, and we're going to make this a wonderful 5 or 6 or 10 years, whatever our time period is. And I often go back to, again, my grandmother's situation. She lived for 7 years with the disease, and I will tell you though, the last 7 years she lived, she grew up a very meek lady in a poor part of Council Bluffs, Iowa, and her last 7 years she lived like a queen, even having Alzheimer's.
Wonderful.
And she lived a life that we would have never expected, even going through a very terrible disease.
Well, and what more can you ask for? I mean,
Exactly.
What an exit.
Yes.
What an exit, and we're all going to go.
Yes.
I mean, that's something nobody wants to recognize, that's an anxiety-inducing thought to begin with.
Right.
And I know with my mother-in-law, and it depends on what stage of the disease you're in. Because
course.
early stage, okay, I can live with this. And then you get to the point where it's like, oh, something's wrong with me. Oh my God, and then you forget. I used to say the blessing is she forget, the curse is she keep remembering.
Exactly.
So you're in a constant flux, of, oh, no, not knowing. It's like being asleep and on adrenaline at the same time.
Exactly. Well, it's interesting because, yes, the different stages mean different things. But what matters to people is to matter and to make a difference. Our Lincoln community, I'll give you a couple examples, and this is not shining a light on us, but I just want to tell you, I want to tell you what you can do even with people that have this disease. Our Lincoln communities, last year, a bunch of our residents went caroling over Christmas. Now, people will tell you, oh, isn't that dangerous? You're taking them outside the building. No, they wanted to make an impact, and if you would have seen the faces of those people caroling, they were doing something that they had done many times before, even having this disease. That can be done.
Right.
We took a gentleman from Grand Island who actually played for the Hastings College football team years and years and years ago, took him down to Hastings College. He got to meet the team, he got his jersey back, he found himself in a picture on that wall. He knew himself, and he was mid to late stage. That's my point. My point is people can still live. And you just have to find ways to make that happen. And good communities and families can do that. You know, mom has Alzheimer's, but that doesn't mean she's not mom. And that doesn't mean what mom wanted to do 10 years ago still can't happen. We just do it differently.
So basically, when we bring them home for Thanksgiving and she wants to help cook or they want to help do something, let them do what they used to do. Just kind of, you know, just help them.
Help them. You know, it's just, you know, it's just continuing to do those things that matter to them, but they might need some assistance. But that's no different than if somebody wanted to do it and they had an eye issue and they can't see so well. You would still help them.
Right.
It's, you know,
Or
if somebody
hearing.
had a mobility issue,
Right.
hearing issue, we're still going to do it. It's, you know, it's the human side of it. It's the human side of it. And what really makes good communities, assisted living communities that deal with that, is that they recognize there is two parts to this. There is the medical and the long-term care, the medical side of it, and then there's the hospitality side of it and the personal side of it. This, you know, this is real. It's not going to go away. We have to pass medications. We have to, you know, assist with bathing and all that kind of stuff. But we don't need to shine a light on this. Let's shine a light on this. Let's shine a light on the hospitality and the personal stuff and the self-actualizing stuff. That's the most important. And that can still occur through any disease, including Alzheimer's.
So it's like what the hospitals are doing now. Instead of making it a white, sterile environment, they're making it a very homey experience.
Exactly.
It's holistic. It's taking care of the whole person, not just part of it. With that, we have to wrap this up. Thank you very much, Marty. I'm looking forward to continuing our series. I'm hoping we find a cure soon.
Thank you, Diane.
Thank you very much for watching Positive Momentum TV, and we'll see you on the next episode.